Good afternoon. I'm Andrew Hayes, Director of Marketing and Communications for World Business Chicago. On behalf of all of us at World Business Chicago, we welcome you to our weekly webinar. Today's topic is managing healthcare costs during COVID-19. We present these weekly webinars as part of our commitment to providing the most up-to-date information, resources, and information to Chicago's business community. You may visit us online 24/7 at our online COVID-19 resource portal, which is ChiBizHub.com/COVID-19 support. It is my pleasure to invite a colleague of mine from our ChiBizHub team to open today's presentation. Welcome, Jasmine Garcia, Business Resource Manager.
Sorry for the delay there. Good afternoon and welcome. I'm here to let's walk you through the agenda first. I'll give you a quick overview of what ChiBizHub is. Right after that, and introducing Mr. Andy Burns, we'll cover the U.S. healthcare costs and updates and cost-cutting strategies. And that'll follow us into a Q&A with David Smith from Key Benefits Administrators and Marisa Gee, script sourcing. Let's see. ChiBizHub is the city's online portal that links expert service providers to Chicago small businesses, entrepreneurs, and startups looking to start, grow, or scale their business. In the wake of the coronavirus pandemic, we quickly shifted our work to include webinars like the one today, providing a forum where our business owners and operators can gather and get up-to-date information in real time, have the chance to get questions answered, and connect with other business owners. In sum, we're all in this together. I welcome you to visit our portal at www.chibizhub.com and check out all the business resource providers available to help your small business. It is my pleasure to introduce today's guest speaker. Andy Burns is the VP of Sales and Marketing for Axion Risk Management Strategies, the longest tenured professional of employee benefits consulting and insurance brokerage in the Chicagoland area. Andy began his career with Axion but prior to his return, he spent 10 years providing human capital consulting and software to Fortune 500 businesses across the country. Andy has invited other notable experts to join him for what is certain to be an engaging and informative conversation. Andy, welcome to the ChiBizHub weekly webinar.
Thank you for the introduction. I appreciate that. I'm excited to be with you all today. Thanks, ChiBizHub and World Business Chicago for making this happen. I think these types of conversations are important, especially now, to just keep people and businesses informed. Also excited to have David and Marisa join us for our Q&A panel discussion towards the end. They both have a number of years of experience in the insurance and healthcare space. So looking forward to getting their insight on some of the topics we're going to talk about today. We're going to go over just a brief overview of our U.S. healthcare current status and then how COVID-19 has impacted that. And I think it's changed, all of our lives, and not just businesses, families, and mental health, and it's changed our new normal. So we're gonna focus our conversation on how we can help businesses manage and cut their current healthcare costs during this crisis. So our goal is for you as viewers to walk away with 2 to 3 ideas that you can implement in your business, or at least have good conversations with your peers in your business to maybe drive some change and maybe tighten the belt with on some of your costs. So if you want to go to the next slide. So right now, our largest component of our GDP is consumption. Durable goods, non-durable goods, things that people are consuming, going out to the stores and consuming. E-commerce has helped us lighten the blow. But, some economists are saying that during this crisis, our GDP is going to take a 5% hit. So it's really interesting to see what's going to happen over these next 3 to 5 months. But U.S. healthcare represents close to 18% of our GDP in 2019, and we spent $3.6 trillion last year on healthcare, which was up 4% from 2008. But some studies show that over the next 8 years or so, it's going to be close to 20% of our whole GDP, which is an enormous number when we're talking over $20 trillion in spending. If you want to hit the next slide. And it's no shock that our costs for healthcare continue to go up. And here's a snapshot of over the last 50 years of what that trend line looks like. If we look at just the last 10 years, healthcare costs have gone up over 200%. And when you look at things like unemployment rate, economic growth, expansion and going through recessions, there's a lot of fluctuation when you look at those things, and they actually start to mirror each other, unemployment and economic growth. But healthcare is one of the few trend lines that has just consistently gone up and to the right year over year. And it's been happening for over the last 50 years. But why is it happening? There's a lot of reasons, but some of the things to talk about are government policy. So since the inception of Medicare and Medicaid, programs that provide health insurance to people that didn't have it, providers have been able to increase prices, and they've increased overall demand of medical services as well, which results in higher prices. There's also, this has been in the news a lot, a lack of transparency from hospital systems and physicians to understand what people are being charged across the board, which has contributed to an increase in costs. Also looking at population growth and aging. Healthcare gets more expensive when your population expands and when people are getting older and living longer. We've got one of the largest generations in our population retiring and getting older, and so that's driving a lot of the cost increases. Looking at disease prevalence and incidence, between diabetes and heart disease alone, they represent close to 85% of our total healthcare costs. And David will talk about this, but there's 25 to 30 categories, chronic diseases that drive up our healthcare costs, and they're more prevalent now than they were 50 years ago. Medical service utilization, looking at things like outpatient services, emergency care, ambulatory costs. All these types of things have nearly doubled over the last 10 years as a result of some of the things that I just mentioned. And then service price and intensity. So, studies will show that things like pharmaceutical drugs and the cost increases represent more than 50% of these types of increases, and including in that is things like your insurance premiums, out-of-pocket costs for consumers. And Jasmine, if you go to the next slide, here's an example of employer-sponsored plans and how expensive they are today. In 2019, for a single person, costs over $7,000 and over $20,000 for a family. So it's no surprise that families and households are spending a ton of money on employer-sponsored plans. And if you go to the next slide, medical insurance trend it's going up anywhere between 5 and 10% every single year. And if you look at this, deductibles have risen over 162% over the last 10 years. Wages have only gone up 26%. So that's a big discrepancy between the two, and it's becoming more difficult for families to pay for their insurance. A lot of the times for an average household income, it's more than 10% of their take-home pay. In some cases, it's 20, 25%, which that's a huge dent in someone's take-home pay. Jasmine, you can go to the next slide. A big driver, and Marisa can talk a lot about this in our panel discussion, is pharmacy and specialty drugs in particular. There were some projections from 2012 to 2020 that costs would increase by over 350%, and those projections were accurate. And why is that? Well, one of the reasons is since 1997, drug companies have doubled the amount of marketing for direct-to-consumer and direct-to-healthcare professionals. And so with those marketing dollars, we've seen a huge increase in people actually buying the name brand drugs. And you have an oligopoly of these big pharma companies controlling the costs and negotiating the costs within the United States. and it varies differently by country, which is something that we'll get into a conversation with Marisa. Next slide, please. And also to note with pharmacy, it's starting to represent 20 to 30% of total cost for some companies. So it's becoming more and more expensive for employer-sponsored plans as well. So this is a good visualization of our national healthcare expenditures, just to show where the dollars are coming from. It's mainly coming from almost 50% is from hospitals and physicians and clinics, and prescription drugs are almost 10% of that as well. So it's it's a big spend throughout the U.S. Next slide, please. So we're really at the mercy of private health insurance. If you look at this graph, since 2008, total private health insurance costs have gone up by 50%. If you look at the Medicare and Medicaid trend line, it's significantly different. And so what's happening is these healthcare providers and hospitals are charging 200 to 400% of what they're charging a Medicare patient, which is just unfair when you're charging an individual or an employer-sponsored or an insurance company that rate. And so there's some things that employers and companies can do to combat that and negotiate deals with either going directly to providers or using a third-party administrator like David's organization to help negotiate some of those rates. So we'll talk a little bit about that as well. Here's another good visualization. This is the CEO of our company. This is one of his favorite slides because this just shows some of the most expensive states in our country relative to the Medicare pricing, and Indiana being the most expensive. Next slide, please. So we have, that was the current state of basically 2019 and creeping into 2020. And now all of a sudden we have this pandemic going on. And so what does that mean for our healthcare costs today? Well, Milliman just produced a really good study that I'll make sure that everybody in the audience gets a copy of afterwards, that COVID-19 could actually cut healthcare costs by up to $575 billion. And it's really because elective procedures and reasons people normally going to the doctor have been avoided, delayed, or completely eliminated altogether. And that's going through June. If it goes through the end of the year, it's going to be even higher. But for commercial insurance like health insurance, we could see a decrease of up to $325 billion due to that deferred care. The main reason is because the cost of that care deferral is significantly greater than the cost to test and treat COVID-19. So what does that mean for businesses? Well, if you're a self-funded plan, you should see a decrease in cost because people aren't utilizing their plans. And if you're on a fully insured plan, you should see or receive a lower renewal on your next renewal, or even a money back from the insurance carrier, or credits or wellness credits, or however they decide to refund their clients, because you're basically paying a lot of money into a plan and not utilizing it. So it'll be interesting to see how it affects employer-sponsored plans. But they're projecting that most companies should see a decrease in their costs. Next slide, please. And this is having a huge impact on businesses financially. PwC just came out with a really great study. They surveyed a number of CFOs, and over 80% surveyed a decrease in revenue. And if you look at this, 24% said a decrease in 25%. So this is having a huge financial impact on businesses not being able to operate the way they normally do. If you go to the next slide, this has really showed some of their key focuses right now, and it's the main thing is cost containment, and that's why we're having this conversation today, because healthcare costs are typically in the top three spends for businesses, and many times overlooked as a vehicle to cut costs. So we'll talk a little bit about that today. But it's unfortunate looking at some of these other areas, changing M&A strategy, look at the different financing options, and adjusting guidance, things like that. These are all huge impacts to businesses, and which is going to have a big impact on our economy. So what can businesses do right now to manage and cut healthcare costs? Well, the typical solution for healthcare to offset costs you hear are offer a high deductible health plan to lower premiums, raise deductibles to lower premiums on your current plans, increase copays, increase out-of-pocket maxes. All that's really doing is just cost shifting to the employees. Or you could just cost shift some of the premium to employees. That's not a good solution. It's a way to lose people, and your employee satisfaction goes down. It's not an actual solution. So looking at a true risk management solution is going to help you reduce costs now and over time. Looking at things like identifying your cost drivers. For a self-funded plan, using the reports you get from your insurance carriers and third-party administrators as your recipe to drive incremental change through your plans. You don't have to wait to the renewal every single year. You can use that type of information to make incremental changes to drive down costs. For example, if all of a sudden you notice in Q1 of this year, ER visits are up, use that information to drive change and drive education and changing consumer behavior to get people to think smarter about their insurance and making sure that they understand their different options. If you're a fully insured business, looking at doing things like biometric screening, because a lot of the times smaller groups, they don't have access to the same type of data a larger self-funded group does, but you can get around it by doing biometric screenings and identifying the population in your group if they're pre-diabetic, if they have high blood pressure, and then crafting a strategy around that to making sure that they're receiving the minimum amount of care to stay out of the hospital or to get even sicker. Evaluating different funding mechanisms. A lot of organizations only think there's fully insured and self-funded. There are a lot of steps in between that you could look at to either dip your toe in the water with self-funding using things like HRAs and level funding. So make sure that you evaluate all your different funding techniques when you're looking at your insurance policies. Changing consumer behavior. This is very important, and these are the types of incremental changes you can make throughout the year. This has to deal with consistent communication and education to your clients on becoming a better consumer. Right now, studies will show that when you go to buy a TV, consumers will use 6 or 7 different resources to buy a TV and shop before they actually make the purchase. Well, with health insurance, people are using 0 to 1 resources before they go get a procedure done or go to the hospital. You live in Chicago, go to Northwestern because it makes you feel good. I'm out in the western suburbs. Most people, Oak Brook, Downers Grove, Hinsdale, they're either going to Good Sam or Hinsdale Hospital. They're not doing research on what their best options are. And so making sure that your employees are informed consumers is key to driving change and making them better consumers of their healthcare. Right now is a great time to look at doing audits. If you're a bigger firm and you're self-funded, looking at things like doing claims audits and RX audits. Some studies will show that 80% of bills have errors on them. You can hire a third party to go in and audit all those plans, and typically you can find significant savings. Doing things like dependent eligibility audits. Sometimes can be disruptive, but right now it's I think businesses are looking for anything they can to reduce costs, and that's a great way to do it. And then finally, we'll talk about all these things in more detail in our discussion, but looking at things like Section 125 plans, David has a great solution that I'd like him to share. That's there's immediate savings for companies on the payroll and FICA side of things, not necessarily on healthcare, but providing a healthcare benefit and taking advantage of some payroll and FICA taxes. So Marisa and David, if I'm going to cue our panel discussion now. Yeah, thank you, Jasmine, for switching that. So you both have been in the business for a long time, and from your standpoint, Marisa, you work for an organization that provides unique solutions for RX and Pharmacy, and David, you do as well, but a third-party administrator have your hands in a lot of buckets. How are you seeing employers being proactive to save money now and in the future? And Marisa, if you want to kick it off, and Dave, please chime in as well.
Sure, thank you. What we've learned through working with groups at script sourcing is that there isn't a lot of transparency. So I'll use the example of PBMs. 75% of the prescription business in the US is handled by 3 big PBMs. It's Optum, it's CVS Caremark, and it's Express Scripts. Now, they are tied to having rebates, and you pay a higher, they make more money, in other words, if there's a higher cost prescription. So what we advocate is complete and utter transparency in that. And if you can, if you're fully insured right now, or you're self-funded, we always recommend kind of unbundling those solutions so that you have a lot of freedom and a lot of transparency. And I'll use the example of the fiduciary PBM. If you can carve out your RX business and you're working with a PBM that charges the same amount no matter what the prescription, right off the bat, you have the opportunity to save a lot of money. So that's kind of a small example of how we help our clients through data and transparency. David?
One of the big cost drivers, obviously, are the claims. And the claims are all driven by people that are seeing the doctor, obviously, and the physicians in this paid for service kind of model that we have right now. The more the physician sees you, the more the money that they make. Well, what we have at the core are the folks that need the most attention most of the time, which would be the folks that have the chronic conditions, which are driving 80% of all the claims out there. What we do is we take a hard look at those chronic conditions, and we get those employees to be compliant with getting the care that they need so they can manage those conditions. If you manage the conditions you have, you can live a longer, healthier, happier life. But if you ignore the conditions you have, obviously they're going to cause grief for you and cause a lot of money to the health plan and a lot of money to your out of pocket. So it's about changing the behaviors of those employees and getting the care that they need when they need the care without putting roadblocks in front of them.
Sorry, I was just unmuting myself. David, I think that's a good segue into talking about how companies can reduce costs by implementing a disease management program, whether it's short-term effects or long-term effects. Jasmine, if you can go to the next slide. David sent this in to me, and I think it's just a good visualization of how their organization uses disease management and proactive health management to drive down costs.
Well, what's interesting, if you look at the bullseye that's on the screen or the target, what you're going to find with all of the employees out there is they break into one of these 3 groups, and we call this the wellness stratification, if you will. So if you look at the center in the red, the center of the bullseye, those are the folks that have chronic conditions. Chronic meaning they're going to have them for a long time. What we have done is through our disease management company, and we own our own disease management company called American Health Data Institute. And it's the largest and oldest population health database in the country, representing about a little over 2.5 million members that their data is stored in this warehouse. What we do is we've identified, by doing this for years and years, that there are 27 chronic medical conditions that make up 80% of all the claims out there. So I'll use the example of someone that's diabetic, and it kind of leads into what I said before. If you are a diabetic and you manage the diabetes, you can live a long, happy, healthy life. But if you ignore the diabetes, it'll kind of eat you up from the inside. So what we do is we identify those folks that have one or more of those 27 chronic conditions, and we coach them to get the minimum level of care for one or more of the conditions that they have. So if you look at the cost of, we'll just say a diabetic, a controlled diabetic may cost the health plan $1,000, $1,500 a year, where an uncontrolled diabetic can cost a group somewhere in the thousands of dollars every month. So what we found is by coaching individuals to get the minimum level of care for one or more of those chronic medical conditions, that we can actually bend the costs arrow that's going straight up for the claims cost. By doing this, we have 4 US patents that will demonstrate that we are actually making a change and the claims costs come down. It just makes sense. If you manage those people with the conditions, get them to get the minimum level of care, claims costs are naturally going to fall. Now, you have 2 more rings here. In the yellow, you've got the unhealthy well, and those are the folks that you find on your group or your employees, if you will, that say they don't have any conditions, they don't take any medication, but tomorrow, unfortunately, those are the folks just right out of nowhere, they have a heart attack. Now, those folks, as you can see on the screen, make up about 35% of the population. Then you've got the healthy well, and the healthy well are the folks that are engaged in doing a decent job of managing their own health. They're eating right, they get a little exercise, they don't have that many claims. Now, from as Andy mentioned, from a disease management standpoint, the focus is always going to be what's driving your cost, what Andy mentioned before. Now, if 80% of my costs are being driven by 20% of my folks, the ones with the chronic conditions, well, what do you do with the other folks? Well, it's almost like you need to build a wall, if you will, around the chronically ill circle there. The unhealthy well folks probably have a chronic condition, or they're well on their way to a chronic condition, or they just haven't been diagnosed. So how do we keep those folks from migrating into the center and ending up with a chronic condition that's going to drive claims and cause them a lot of issues? We have another product that's that was born out of our disease management program called the Proactive Health Management Plan. And it comes down to just focus on the word proactive. And if you think about even chronically ill folks, if you're proactive and you manage your condition, everything's going to be wonderful for you. You're going to save money, time, and distress, just like the employer group is going to do from saving money on claims costs. Well, if you look at typical wellness programs that have been out in the market, they don't get much participation. Typically, you get a few of the chronically ill people that participate, and you get a few of the healthy, well people that participate. The product that we have, the Proactive Health Management Plan, is a wellness initiative that engages with everyone throughout the entire bullseye here, the chronically ill, the unhealthy well, and the healthy well. But there's a huge focus on the unhealthy well and the healthy well to keep them out of that chronically ill space. And how our program works is it's all about being proactive. If we can prevent you, help you get on the right road to not incur or come down with a chronically ill condition, everyone's going to be better off. So what the Proactive Health Management Plan does, it's designed to change folks' behaviors. And it really makes a huge splash in the unhealthy well and the healthy well to kind of keep them out of the center. It engages with the employees, and there's a built-in incentive that's in the program. So as the employees participate in the Proactive Health Management Plan, there are claims that are paid to those employees that make their spendable income go up. So the employees will see an increase from 2.5% to 5% in their income when they participate in the Proactive Health Management Plan. The program is paid through a Section 125 premium only plan. And like Andy mentioned, one of the byproducts of a premium only plan, Section 125, is the employers save money on taxes. But one of the byproducts of that for the employer is there's also tax savings built in for the employer. The PHNP will generate about a $324 savings per employee for the employer, all while incentivizing the employees toward better health. So to kind of sum up, it truly, to manage your health costs are going to be how you're going to save money on your healthcare spend. And it's all about changing and managing behaviors of those employees.
Yeah, so for those of you tuning in, this is what I was referring to for immediate savings. What can I do right now to save money and provide a good benefit? So this is something that we've evaluated and communicated to some of our clients and prospective clients. It's a fantastic offering and a great way to provide a benefit and save money. And David can provide more information after this in our follow-up. Marisa, David was talking about some chronic diseases like diabetes and heart disease. What your organization does very well is find ways to reduce the spend on RX and pharmacy. Talk a little bit about how you do that. What's wrong with our current system that we're in the U.S. being charged so much for certain drugs, where overseas it's a fraction of the cost, and how your organization is helping businesses connect those dots.
Sure, thank you. You're exactly right. Here in the U.S., we find that we're charging anywhere from 2 to 10 times more for prescriptions than they are in other countries. Part of that is our kind of lobbying efforts that happen here. The prescription lobby is the largest in the country. They spend the most money. Part of it is that people, as I talked about before, the way that the PBMs are set up, part of that cost is tied to the rebate system and coupons. I'm sure you've heard of when you watch the commercials for the expensive prescriptions and it says, if you can't afford your copay, call, because AstraZeneca or whoever can help. But those systems, actually, those coupons, they undermine the efforts of employers and consultants to drive behavior and to cause changes in utilization in the prescription area. As an example, if you had somebody in a high deductible health plan who has, say, a $5,000 deductible, and they're on a prescription that costs $60,000 a year, they get a coupon for that $5,000. So the employee isn't spending anything, but that cost is shifted to the employer. So there's really no savings. What script sourcing does is we look at all of the data that's coming through on prescriptions, and anything that's a brand name maintenance medication or a specialty medication, we are helping to source in alternative ways. It's important to note that we only use tier 1 countries. Tier 1 countries are defined as the same quality standards that the U.S. Congress demands for U.S.-based pharmacies. So we are absolutely not talking about some Amazon warehouse somewhere with counterfeit drugs. And it's really important to note that now there is heightened security around all of this because of kind of fake COVID-19 cures that are being sourced, hand sanitizer, things that really aren't up to FDA grade. So with script sourcing, we only work with pharmacies in tier 1 countries. It's the UK, Canada, Australia, and New Zealand. We have visited these pharmacies. We work with them. Once a consumer is set up with us, they receive their prescriptions every quarter. It's a 90-day supply, and it's really a seamless process. And in many, many cases, we find we're averaging a 70% savings on the brand name medications we're able to source. Specialty is a little different. Depending on the PBM, we can also source many of them through our international programs. We can also work directly with the manufacturers, and we have a way to tap into the $7 billion that Big Pharma has given away in the last year, as an example, to get those specialty medications sourced for free for both the consumer and the employer. You're muted, Andy.
There we go. Thank you. Now, is this for only self-insured clients? Can you peel away for a large fully insured client?
If you're willing to carve out on the prescription, before I came to script sourcing, I was a broker consultant for many years. And I did have clients that, depending on who the carrier is, and of course that leads to the unbundling and the transparency that we talked about earlier. But if you can carve out your prescription and self-fund even just the prescription piece of it, we can work with you. If you remain fully insured, you're not going to realize the savings.
Sure. Well, that brings up a good topic for both of you, because you've both been in the space for a long time. Why would self-funding, and this is just posing a question, why would self-funding be a better option versus fully insured? We're starting to see a lot of smaller and mid-market businesses move to self-funded models. Just talk about some of the benefits of being self-funded. And David, this is really both your world, so I'd love to hear your thoughts on this.
From the self-funding aspect, it's, we all understand how loss ratios work, and given the fact, your loss ratio is how much money did you spend versus how much was spent on claims. So if you spent $100 and 60% of the money you spent went toward claims, that would be a 60% loss ratio, which means 40% of what you spent didn't go to pay claims, so it went to admin or something of that nature. Now, we always say, I guess the longer I'm alive, the more I realize everything is kind of centered around the Pareto principle, that 80-20 rule. So if you look at your own lives, the typical person out there, in a 10-year period, you're probably going to have, 1 or 2 years, 1.5 years, if you will, where you spend money toward your out-of-pocket on your medical plan. The other 8 years, if you will, maybe you have a cold, flu, cough, minimal expenses. Well, that's how businesses are with paying group health insurance for what you pay on an annual basis versus what's actually spent on claims. So to give you an example, when you are fully insured with one of the BUCAs, the Blue Crosses, United, Aetna, those folks being fully insured, if you have a 60% loss ratio, meaning all the money you spent, only 60% of that went to claims, the other 40% went in the coffers of your fully insured carrier. Now, when you're self-funded with a 60% loss ratio, that 40% stays in your pocket. When you're fully insured, you really do not ever have the opportunity to save money in the good years. And if we look at the Pareto principle again, the 80-20 rule, 80% of the time, you are going to not ever come close to spending on claims all that you spent on your benefit package per year. So being fully insured, you never have the opportunity to save money in the good years. That's how self-funding benefits everyone all the way around. You look at it, if you have a 500-600 person group, does it make sense for them to be fully insured? No, that's why they're all self-funded. And it transcends all the way down to small group.
In addition to that, when we talk about driving consumer behaviors, when we talk about using data to craft a plan that makes sense, that can help us save money over time, if you don't have any data, and depending on the size of your group, when you're fully insured, you're not going to get data from your carriers, as David mentioned, the BUCAs of the world. There isn't that transparency. So you may get a report once a year that says, oh, you spent $100,000 in premium and you had $750 in claims, but you may not be able to drill down to how many percentages were steerable ER visits, for example. How many percentages were a prescription that maybe was for something that could be taken care of either over the counter or in a more cost-effective way. So by moving to a self-funded arrangement, you have much more freedom over your data. You have much more transparency. And quite honestly, you have the opportunity to save more money than when you're all bundled together, which is kind of counterintuitive because most of us think like, oh, if I bundle my home and auto, I'm going to save money. It's not always the case when you're with a fully insured carrier. And it's important, Gary Becker, the founder of our company, always talks about sometimes employers get into a little bit of a Stockholm syndrome where because you've always had that blue card in your wallet forever, you think that's the only option. And we're so fortunate to live in a time where that isn't the only option anymore. And we have the freedom to craft plans that really suit our needs.
Yeah, I certainly think it's something for businesses to consider because if Milliman's right and we're going to see some decreases in lower renewals coming up, that eventually is going to come back to bite us in 24 months when the insurance companies start tapping into the reserves and people start seeing increases in double digits that we've seen in years past. I talked a little bit about doing audits, Marisa and David. Talk to me what that looks like for a business to go through, say, a claims or an RX audit. Marisa, you probably do a lot of the RX audits, but David, on your side, what does it look like to go through something like that?
From an audit standpoint, looking at behaviors and looking at claims, it's exactly what Marisa mentioned. You can't manage the risk without having the data in front of you. If you don't have any knowledge, how are you going to make good decisions? You mentioned earlier about getting reports and seeing spikes in emergency room claims, or looking at compliance rates, meaning, when I mentioned before, of those 27 chronic medical conditions, are your employees that are driving all of the cost, are they getting the care that they need when they need the care? Because if they're not, they're uncontrolled or not controlled as they should be, which is going to cause spikes and things of all that nature. But you look at, from an audit standpoint, we look at, are you getting the best discounts on the providers that you're seeing? So there's a lot of moving parts. And then also with the RX, well, Marisa will talk about that, with, are you getting the best deal you can for the prescription drugs that you're utilizing? When you're fully insured, you're just at the whim of whatever the fully insured carrier thinks the best deal is. And you got to think 99% of the time, the best deal is always in their favor, not you as the employer.
When we think about RX audits, there's kind of three big areas. One is your PBM what we call kind of chasing rebates? So by PBM, that's a pharmacy benefit manager. That's kind of the back of house administrator that handles all the RX. They make the deals with the manufacturers. They make sure that your consumers can pick it up at the drugstore. So if they're chasing rebates, there is absolutely no incentive to get someone off of a very expensive drug. And I'm not here to say that they shouldn't be on a life-saving drug if it's out there. Absolutely. We just want to find a way to pay for it that makes sense for everybody. But if it's something that can be taken care of without that very expensive drug, have we tried it? So are there pre-authorization protocols in place? Is there fiduciary review in place? So that's one area of audits. The second area, which is really important, is non-adherence to medication. If we're looking at someone who regularly gets a brand name maintenance medication, maybe it's for something that's manageable, maybe it's diabetes, maybe it's a high blood pressure, a cardiac condition, but we're finding that they're only filling them 9 months of the year. We're only filling them 8 months of the year. That person is dose skipping because they can't afford their copays. And you think of an average family, so many people are living paycheck to paycheck. And depending on how your pharmacy plan is structured, if there's say a 25, 50, 75 or a 35, 7,500 copay structure, sometimes asking someone to come up with $50 a month or $75 a month for that medication is a lot out of their family budget. So they may not do it this month. They may only take 2 pills a day instead of 3. And that leads to greater medical claims down the road because they're not taking care of what they could earlier on. So that's kind of what we look for in RX audits. We look for things like, first of all, are there the pre-authorization, the fiduciary? Does it look like it's regularly being filled? Is it sourced? There are examples of medications out there. Duexa is a good example. It's a painkiller with an antacid because sometimes if you take the painkiller, your stomach gets upset. Now, this medication is outrageously expensive because it's a dual piece that's combined. So there's a new patent. You see where this is going? So we want to look at that and we want to make sure that the protocols are there to ensure that that's the correct medication for that person for that condition.
Thank you for that. We've got about a few more minutes because I'd like to leave 10 or 15 minutes for anybody who wants to ask questions. The last thing I wanted to talk about briefly is reference-based pricing. I feel that this is the future of insurance and risk management and working directly with providers and negotiating rates or using organizations like key benefits administrators to help negotiate some of the charges from hospitals. David, walk through high level what a reference-based pricing program looks like and some of the benefits that companies can see if they go that route.
Well, reference-based pricing is an interesting lot, and sometimes it goes a couple different ways. The term reference-based pricing means that you're finding a reference and then you're basing your pricing, your reimbursements based on that reference. And a lot of folks use Medicare pricing, and then they use that as the reference and add a percent to it, and that's what they will reimburse providers for given certain type of procedures. So let's say Medicare plus 35%, which would mean in a health plan, you would reimburse the doctor and or hospital at the Medicare rate plus the 25, 30, 45%, however you set up that contract. What that does is it kind of takes the fat, if you will, out of what's paid between Medicare and what's paid in the private market. Medicare reimbursements are so low that in essence, sometimes the providers don't really even make enough money to turn on the lights based on those rates. And what happens then is we in the private market kind of get overcharged. And so your typical PPO, the different local PPOs and national PPOs are out there, and even the networks of the Blue Crosses, the United Healthcare, their standard reimbursement contracts are much, much, much higher than the Medicare. So the reinsurance companies and administrators have found a way to negotiate with the hospitals and bring those costs down. It's another cost containment type of process. And if the hospitals are willing to negotiate, these can save monies for the health plan and for the employee.
Yeah, these types of plans, I mean, looking at some analysis, I mean, they could save anywhere between 40 and 60% on plans. Granted, there's, some bumps in the road rolling it out, and there needs to be some champions and key stakeholders internally for businesses to help administer it. But it's a great way to significantly reduce costs, and a great risk management tool for your healthcare spend. So we've got about 14 minutes left. Jasmine, I'll turn it back over to you. Thank you, David and Marisa, for the discussion. Jasmine, have there been any questions that have come in?
Hey, Andy, it's Andrew Hayes. I'll take that.
Perfect.
Thank you very much. We did get a couple of questions. One is relief through the PPP forgivable when spent on group premiums?
Yes. So the employer portion is forgivable through the PPP program.
Okay. And then we had a couple comments from someone. I think they've got a very small business. And so the concern was that, or the complaint or the concern was, there doesn't feel like there are many sustainable options for very small businesses. Any recommendations, advice you can give to those who are operating either sole proprietorships or very small enterprises?
Anyone? I mean, I could take a stab.
Go ahead.
So there's talked about looking at things, the in-betweens of fully insured and self-funding. And there's things like health reimbursement arrangements where you're in effect self-funding the deductible. So if you take a plan, you've got maybe you've got a $1,000 deductible. Instead of having $1,000, you have a $5,000 deductible or a $3,000 deductible, and the employee is responsible for the first $1,000, and then the employer is responsible for the back half. What that does is, depending on the size of the organization, it may or may not make sense. But if you've got 20, 30 employees, 40 employees, it might make sense because it significantly lowers your premium. But it may not everyone's going to go to the hospital and satisfy their full deductible. So that's one option. The other option is, looking at a level funding solution, which is kind of a hybrid between a fully insured and self-funded product, where if you basically operate like a self-funded plan all year long, and if you run well, you get a rebate back. And if you don't, it factors into some of your stop loss and your fixed admin costs. If anybody else wants to chime in for some ideas for smaller employers as well.
That's probably the most useful right now, depending on what state you're in. I know I personally grew up in New York State, and there are size limitations on where you can go self-funded. There are other states that you can go self-funded and be more flexible at smaller. I have looked at groups that had as low as 10. So it's out there, it's possible. It just depends on your state regulations as well. And you're kind of getting into the law of large numbers there also. If you have a very small population, one very high claim is going to really impact you versus if you have a larger population, you can kind of ride out the percentages.
David, what do you think about maybe even for, like the minimum essential coverage plans, our initial conversation, looking at some of those plans as a way to reduce costs, still have some coverage. It might not be as comprehensive as a Blue Cross PPO, but if cutting your costs is a huge concern and you can't afford, the fancy shiny PPOs, what do you think about piecing together a program like that?
Well, there have been, what you're kind of alluding to are the limited medical products that are out there, where administrators will put together, a plan that covers the minimum essential coverage, which gives you all of the wellness benefits that's covered under the fully insured carriers, plus a lot of other pieces that they bring into it. So you have a little bit of prescription drug coverage, you have a little bit of office visit coverage, and then you add things such as critical illness plans and things of that nature. It's enough to keep the wolf away from the door, and really everything has to be kind of measured out based on what you can afford. Sometimes you try and get these really high deductible plans, but they don't do you any good because they don't have any of the first dollar coverage. So looking at those things, you want to make sure they deliver the day-to-day things that you need to get some value, but then they do have some catastrophic coverage to cover you if you didn't have some catastrophic claim. Those are something that employers are looking at for some of their employees.
Yeah, I think too, even on the, for certain employers who, for the employees that, say this is too expensive and they send them to the exchange or they go to the exchange, you can even offer it as a voluntary option. It could be at least, the company showing the love that you're trying to provide an option that's much more affordable for them.
Yes.
That's great. Thank you. We have no further questions. So with that, we will conclude this afternoon. Marisa, David, Andy, thank you for giving us some time and your expertise. I know this has been incredibly helpful. And thank you to all those who've joined us this afternoon. You can find information 24/7 on our COVID-19 resource portal at ChiBizHub.com/COVID-19 support. Thank you all for joining us. We wish you well. Stay healthy.
Thank you.